So what are macular degeneration causes? That's an interesting question because after years of research, the answer to that is not entirely clear. There are definite genetic predispositions. In other words, there are abnormalities of the genes that result in abnormalities of the immune system, such as complement factor H abnormalities, which is one of the factors that mediates inflammation throughout the body. There are possible environmental factors. We know that smoking significantly increases the risk of macular degeneration and subsequent blindness. It is ultimately a disease of senescence, of time, and to some extent macular degeneration may be just age-related changes. However, some patients develop more severe changes, and that is why there is a pathological basis to it that is still being studied. The role of nutrition in macular degeneration is still being evaluated. We know that a plant-based diet is protective for overall eye diseases. The retina requires luteins in high doses, particularly in the central macula that resolves most of your fine vision, such as reading. Luteins cannot be obtained through any other source except plants. The body cannot synthesize its own luteins. And some of my patients who use lutein supplements certainly find that they have reduced symptoms of glare. Omega oils have also been studied in macular degeneration, and although the evidence on this is non-conclusive, when we look at population studies, omega oils does seem to have a protective role. There are interesting variations in the different types of wet macular degeneration between different populations. For example, in the Caucasian or European populations, what we most commonly see what's called a choroidal neovascular membrane. In the Far East and in Asians, and to some extent Africans and Caribbeans, polypoidal choroidal vasculopathy is a more common subtype that presents. Patients who have very high intakes of vitamin A, such as in Japan or in Iceland, who have a very fish-based diet, seem to develop what's called atrophic macular degeneration, where the retina becomes thin. We don't know if this is lifestyle dependent or as a result of genetic variation, but it certainly does raise concerns about very high doses of vitamin A in macular degeneration.